Hi, my name is Summer Durante-Murray and I'm coming to you from the Center for Skin and Cosmetic Dermatology. And today we are going to be performing a cutting-edge laser procedure, Photofractional, using the M22 laser by Lumenis. After we prep the skin and remove all the makeup and degrease it, get all the extra oils off the tissue, we then apply a clear ultrasonic gel. This gel is used for conduction for the IPL, or intense pulse light device. It helps to keep the skin moist, but it also acts as a cooling agent for the tissue. While we're doing the procedure, the patient is a lot more comfortable using this. The first step in this procedure is going to be performed using the IPL machine. We are using a 560 nanometer filter. We will treat the entire face with this filter before we move on. The combination of doing a photofractional, combining the intense pulse light and the fractional procedure in one setting, is phenomenal. This allows us to take our procedure to a completely different level, a cutting edge sort of thing. Basically, when you're treating a patient with intense pulse light by itself or fractional by itself, when we combine the two, there is a synergistic approach that's happening within the tissue, and it allows us to achieve in one session what it would normally take 3 sessions to do with either modality by itself. Total treatment time for the intense pulse light portion of this procedure is going to run about 20 minutes. If you want to include the prep time and the cleanup time, that will add another 10 minutes. So a total of 30 minutes from beginning to end. Intense pulse light, or IPL, is used to treat anything red and brown, superficial red and browns, meaning it's perfect for rosacea, for little broken capillaries, little small veins on the face. Also very good for treating age spots, sun damage, freckles, any of that thing. When we're treating the red conditions, the rosacea, for example, or a broken capillary, when we shoot the IPL device, we choose a wavelength that's appropriate based on the patient's skin type and where we think that vessel lies within the tissue. It's a really great machine because we have the ability to choose based on depth, which doesn't limit us for what we can and cannot treat on the skin. IPL energy is then absorbed into that target or that vein or that vessel, and it actually is irritating the vessel wall itself, causing the vein to, or the rosacea or the matting of the tissue, to collapse down under the skin, and the body then absorbs it and flushes it out the system through natural means. Immediately post-treatment with the IPL, if you get a really great aggressive clinical response, it's a really good idea for patient comfort to apply a soothing gel, like a hydrating serum that may have some hyaluronic acid to it. It's something that we do for our patients on the half of the face immediately post-treatment when we turn them over to treat the other side, just so that there is an additional cooling benefit and it kind of soothes and calms the skin. Our clinical endpoint for treating anything vascular or red is darkening of that lesion, making it angry or turning almost a purple hue in appearance. That is a completely acceptable clinical endpoint. The clinical endpoint for pigmented lesions is 50% darkening of that lesion. That's how we know we've achieved a successful treatment. Now we are going to treat the depressed acne scars, the atrophic acne scars that this patient has on her temporal region. And our settings are different whenever we spot treat with the acne scars. We actually use a lot more energy and a lot less density with our spots. When we're using the fractional component of this procedure, we are doing collagen remodeling, which is tone, texture, and tighten. And so in that, we're going to see, patients who have some flaccid skin, loose skin tissue. We're going to treat patients who have the crepey under the eyes, tissue, any loose skin that might need additional tightening or thickening of the skin, because as we age, our skin tends to thin. This procedure is great for thickening the tissue as well. It also is great for taking care of any residual vascular conditions that might not be able to be completely cleaned up with an intense pulse light or a laser procedure. It does really good at helping to clean up some of that additional stuff. Any additional deep pigmentation as well, it will help to get rid of that too. If you have resistant pigmentation and you've taken all the necessary steps through chemical peels or intense pulse light therapy procedures, the fractional procedure can clean up anything that's left over because it's going a lot deeper into the tissue. For the resurface photofractional part of the procedure, that will run about 30 to 45 minutes, depending on if we're doing any baseline treatments or spot treating for acne scars or deeper wrinkles such as vertical lip lines or crow's feet around the eyes. If we add that additional pass, that will add on additional time for the procedure. Now we're moving on to treating full face. We've adjusted our settings accordingly. We are at 300 spots per centimeter squared, 12 millimeter spot size, and we're choosing the square today at 40 joules per centimeter squared. One of our main objectives as clinicians is to keep the handpiece with any laser procedure perpendicular to the skin at all times. For the photofractional part of the procedure, we are limited to skin types maybe 4 and lower, meaning our olive complected or lighter Hispanic patients can receive this procedure. If a patient comes in and they have a need for fractional laser alone, we can treat any skin type with that. There is no limitations or worry about post-inflammatory hyperpigmentation or anything dangerous in terms of the treatment. But in terms of photofractional, if a patient has olive complected skin or lighter, they are completely safe to receive this procedure. This is considered a zero social downtime procedure, meaning you do not have to hide in the house and recover. You will have some minor erythema and swelling or edema post-procedure. The edema or the swelling is actually induced from the thermal damage of the laser procedure itself, and that's needed in order to obtain the collagen remodeling. So the best description we can give you in terms of how that's going to feel is that your face feels very puffy or tight during the post-procedure part of it, and it's going to remain kind of puffy and tight for 2 to 3 days post-session. Post-procedure peak results are achieved 3 to 4 month time frame after your first session. Now keep in mind, if a patient needs multiple sessions because they have severe flaccid skin or they need additional skin tightening or we're treating acne scars, those patients need to be seen anywhere from as soon as 4 weeks up to 6 weeks post-procedure. And there's a benefit to doing that. Even though peak results are not seen 3 to 4 months post-procedure, we because a lot of the work that's taking place is taking place on a dermal level. So we can't see a lot of those changes with the naked eye until we've given it time. And that 3 to 4 month time frame is where those results, all the work that's taken place on a dermal level, is able to be visually seen with the naked eye. Now, if a patient needs additional sessions, it's wise for them to come in between the 4 and 6 week mark, because we have stimulated a lot of the fibroblasts and the collagen, and we want to capitalize on that. We want to hit it again before it actually has a chance to kind of go back to its baseline way of being. We want to hit it again so we can kind of snowball it and we can kind of get more oomph out of our second treatment that way. Immediately post-treatment, you're going to notice a lot of erythema, which is just pinkening, redness of the skin itself. It's going to feel like an aggressive sunburn to the patient. It's going to also look like a sunburn for most patients. I find that the patients with a fairer skin complexion tend to have a little bit more pinkness or redness to their skin than the patients who have more of an olive complected tone. They may be pink for a little bit, but then the next day that pinkness has typically resolved. The patients who are very fair can hang on to that erythema or that pinkness anywhere from 3, maybe 5 days. It just depends upon how aggressive we choose to go with the procedure, or we need to go in order to achieve the results they're wanting to obtain from the procedure. After the hydrating serum, the hyaluronic acid-based hydrating serum, we apply a product called Quench. It's aloe vera based, very soothing to the patient's skin, and has vitamin E in it. And the patient will take this home with her to use on her skin post-recovery. And last but not least, we apply sunblock, SPF 30 or greater.